So what you were looking at there is called a seroma. It's something that is relatively common when it comes to kidney transplants. It's a collection of fluid that forms around the incision site. So with mine, they actually had to cut through the skin and a lot of the fat because, as you saw, I have a stomach, so there's a lot of adipose tissue or fat in that area. So I had to cut through that. What ends up happening is like I think it's called interstitial fluid collects. Now, it doesn't hurt when I touch it. It doesn't hurt when I lay on it. I'm not in any pain. It's just a collection of fluid. And the signs the signs that doctors have looked for when it comes to the seroma to make sure that it's not infected or it's not a real problem is they want to make sure that it's soft. And they also want to make sure that it's not red and inflamed. There's no irritants. It's not irritated. And it's not red. And there's no drainage. And I've had this happen before where, if I had fluid collection from doing peritoneal dialysis, the catheter stopped working. The fluid got trapped inside my body. So it pushed itself. The fluid inside my stomach pushed itself through my belly button because there was an incision site there in order to put the PD catheter in. So it ended up pushing itself through my belly button, which had an incision in it from that surgery, and the fluid just leaked out of my belly button onto the floor. With a seroma after a kidney transplant surgery, they want to avoid that. So what can happen is that over a couple of months of monitoring, it's possible that your body can reabsorb those fluids. But when I spoke to my doctor about it at CPMC, my transplant team, they said give it about 2 months and see if the swelling will go down. If it does not, if it persists, then you got to give us a call and we can have it drained. Now, how I think they're going to do it, if I need it drained, is they're going to make an incision. They're going to insert a needle and they're going to pull the fluid out with the syringe, which is something I'm not looking forward to. So I'm actually just going to monitor it and hope that it will go down. But currently, there's no risk of infection because it's sealed in the cavity of my body. And there's no symptoms. They also look for fevers, which is a sign of infection. It's like one of the first stages of an infection. It's not red, it's not sensitive to the touch, and they also want to make sure it's not hard. I don't exactly know what it being hard entails. Maybe solidification of the fluids. I don't know if it's going to need major surgery, even a bigger surgery and not just a invasive procedure like drainage or not. But it is something that can happen. And it's nothing to really panic about. But you always want to make sure that you don't just take it for granted. You always want to make sure that you tell your care team when something like this happens. Now, my care team at CPMC, the kidney transplant center, all of my doctors are aware of this. Nobody is in the dark. You can't be one of these patients that's just like, oh, F it, doctors are quacks and I'm not going to go and they don't know what they're talking about. Right? You're talking about a brand new organ that you waited a long time for. And the last thing you want to do is jeopardize that organ because of ego or pride.